episode of The Y Factor. We are very honored to have Dr. Anjali Saple. She is Vizag's top cosmetic and plastic surgeon. Known for blending the science and artistry, Dr. Anjali has transformed the way people look at plastic surgery, helping countless individuals to feel confident under their own skin. And Dr. Anjali is inspired by her mother, and yet she forged into the male dominating field and handling challenges all head on like a pro. In today's conversation, we're going to discuss the future of the plastic surgery in India and how the West has been inspiring East and particularly India for the plastic surgery, and how people are getting more empowered to feel beautiful and confident in their own skin. But also we're going to discuss the challenges that comes with it and the dark truths about the plastic surgery that hardly comes to light.
So, Hafsa, thank you for having me here. And before you start your questions, let me just clarify one point. You just said that the West inspires the East in plastic surgery. Well, that has not been that. It has not been so. It's been the East has always inspired the West.
Oh, that's amazing.
Yes. Plastic surgery was actually born in India. In fact, Sushruta is known as the father of plastic surgery. So it is he who started this whole subject of plastic surgery, where he devised how the Indian noses could be reconstructed, and he's actually the forefather of plastic surgery. So let's just clarify that first.
Yes, that's great. I think that's something that most of us didn't know about, but
Yes.
because when we look at the plastic surgery as a whole concept, and coming from a non-medical background, I guess, where 80 to 90% of the individuals out there is what we think collectively, ki maybe that is something that we got inspired from. But I think that's why we have you here to, clear all the myths and clear all the misconceptions about the plastic surgery. So, ma'am, just let's start from the very beginning. So, how does Dr. Anjali as a kid was, and how were the humble beginnings to what you are today? I think you come from a business background as a family, and you being a as a surgeon right now is something. It's like a poles apart right now, right? So how did the humble beginnings start from, and what inspired you to embark your journey in plastic surgery? And be the first woman plastic surgeon in a city called Vizag. So yeah.
Okay, yeah, humble beginnings is right, Hafsa. Actually, we come from the land of Sindh, so we started with practically nothing. But it was like the tenacity in my family, the value of hard work that really got us to where we are today, all of us. And yes, predominantly it was business people in my family, but my parents, both my mother and father, wanted all of us, we are three siblings, so they wanted all of us to be very highly educated. And the seed of becoming a doctor was sown very early in my childhood by my parents. So I guess that is what kept working on my mind. And somewhere that was always there in my subconscious that yes, I need to become a doctor. And once I did my medical career, I was always drawn towards surgery and then towards plastic surgery, because plastic surgery is a specialty where art and science blends together. So that is something that probably always drew me towards it. And I think it's like always they say that when it's like your guru finds you, or your calling finds you. So this is like probably my calling just found me. It was like the whole universe conspired, and I kind of landed into this field of plastic surgery.
That's great. So when you say plastic surgery is also a form of art in its own thing, right? So how would you comprehend that and articulate that? Let's say when we look into the medicine, or when we look into any doctor or a surgeon, it's mostly technical is something that we perceive as common people out there, right? And could you explain how the artistic form is actually really inspiring for plastic surgery, just in case, and where do you actually get it from? So I think your mom was also an artist.
Yes.
Is there something that really inspired you to get that roots in the medicine and mostly the plastic surgery right now?
Actually, yes, I think I would like to attribute a large part of this to my mother. She was a very she was an entrepreneur in back in that in those days and age. And she used to, along with being a homemaker, she used to also do a lot of stitching. And I remember when she would stitch clothes, the finer points like the hemming and say, probably the buttonholes and the hooks, that was our job. So anything that was not in place was quickly ripped off, and we had to do it all over again. So it was like the perfection was, probably that is where it started. And since you rightly said, yes, medicine is predominantly technical science, but every person, every patient is different. So it's not just that A plus B is equal to C. That doesn't work in medicine. We have to go into a lot of the patient's history, and only then we are able to decide, okay, this is the diagnosis that fits the patient. Plastic surgery takes it a notch higher, because there it is not just the technical expertise that matters. Anything can be dealt with differently by different plastic surgeons, because every person has a different artistic sense. So that is where the art form comes into play. So I think that gives it that individuality, that uniqueness, which is, I think, very, very special to plastic surgery.
Got it. So, how did you do your medicine? From which college, ma'am? So, let's say, I think you told that you come from Bombay, right?
Yes.
And how did you land up in Vizag? So, just a brief view of the journey from the medical college to what you did later in the fellowship and PG and the mentors you learned from, and then how did you actually come to what
So
you are today right now?
my entire education has been in the city of Mumbai, and I studied medicine in Lokmanya Tilak Medical College. It's known as Sion Hospital, and that is where I did my basic medical training. In addition to surgery and plastic surgery, we had the illustrious Dr. Ravin Thatte, who was my mentor and guide, and after that, basically, it was probably destiny that brought us to the city of destiny. So we decided to give a try to the city of Vishakhapatnam, because this is where this hospital was kind of expanding. They were looking at somebody who could start a plastic surgery department here.
Okay.
And that I thought was a pretty challenging role.
Yeah.
So I decided to take it up. So it was like absolutely, there was nothing in plastic surgery here. People did not know the subject of plastic surgery. So it was really enjoyable and exciting to start the department right from scratch and bring it to where it is today.
Got it. And also, ma'am, I think plastic surgery in itself is a very male dominated field, right? And how did you, as a female plastic surgeon, thrived in it through the years of what you worked in your professional career? And what are the most challenges you faced? And let's say we can also top it off with the different kind of surgeries and something that levels from the highest riskiest to the lowest, and how the female attributes are distributed among these surgeries pan India, or the field in general. So yeah.
Male dominated, yes, it was at that point in time. Now, of course, it's changing. So we are getting a lot of females in coming into this branch. But yes, when I started back then, there were a lot of naysayers. They said, no, do not get into surgery, because this is a male dominated field. So one, you will not be able to go through the grind, and two, people will not want to come to a female surgeon. But somehow I decided that this is my calling. I have only one life. So yes, let me do what I want to do. And I would say, yes, I did have to probably work twice as hard as probably male colleagues, because when I came to Vishakhapatnam, people were not really confident that I would be able to handle the difficult cases that were being treated in this hospital. And I had to really prove myself as a surgeon. But once that was done, there was no looking back.
Okay.
Regarding the complexities of surgeries, there are, yes, multiple levels of complexity. I think in plastic surgery, the zenith would be like super microsurgery, and where, we anastomose very, very fine blood vessels under the microscope that requires hours of diligent work. And we have done such a case. It was actually the first such case done in Andhra Pradesh, where we managed to transfer the toe of a person who had lost both his hands to the thumb. So he
Okay.
had just three fingers in one hand, and the thumb was not there. The other hand was amputated. So he was, basically he was
Yeah.
not able to use his hand at all. So we did a transfer of the second toe from his
Okay.
foot and reconstructed it to form the thumb, so that at least you could get a grip in one hand.
Hmm.
So this is probably, one of the very difficult cases. There are many more, but yeah, like this is an
Hmm.
example.
Yeah. So, ma'am, let's say for viewers and obviously for me, so if you have to, explain in a simplest way of how many types of plastic surgeries are there, because we always think plastic surgery is just for the face, right? Or maybe when you said you actually help the amputated guy's hand from the toe to actually keep it on his hand, right? So I think there are different levels of types of surgeries in the plastic surgery domain itself. So for someone who's actually listening for the first time, so how would you articulate the entire thing of what are the different kind of surgeries in plastic surgery in general? Yeah.
So, yes, plastic surgery in lay people's terminology, as you said, they associate it with cosmetic surgery. But I would like to say that plastic surgery is basically has got two parts. One is reconstructive surgery, and one is cosmetic surgery.
Okay.
In reconstructive surgery, we reconstruct the tissues which are not normal.
Got
So
it.
they could have been damaged in the course of an accident, or burns, or cancer, or it has been the child has been born like that, as we call as congenital deformities. So that falls under the ambit of reconstructive surgery, whereas cosmetic surgery is what is normal. You're trying to beautify it. So that is where you have, like, say, rhinoplasty, or you have a liposuction, or you have a face changing surgery. So that kind of thing. So these are the two different modalities that we have in plastic surgery. Most of the plastic surgeons start as reconstructive surgeons, because that gives you the grounding, and then you hone your skills, and then you go into the area of cosmetic surgery.
Got it. So when it comes to cosmetic surgery, ma'am, can we, again, segment this and then can you explain like what exactly rhinoplasty is, and
Yes.
then coming down for different kind of things that falls under the same cosmetic
In
surgeries?
cosmetic,
Yeah.
right? So plastic surgery is one domain where we don't restrict ourselves to one area of the
Yeah.
body. So we touch anywhere between the head to the toe is,
Yeah.
we cover plastic surgery. And cosmetic surgery for you is like, from the face. You can start from the head, actually. So hair transplant. Coming to the face, you have anti-aging surgeries. So, you have, like, the eyelids are drooping, or there are eye bags. So we have blepharoplasty for that. We have for the nose, to beautify the nose, or it could be a nose which has been become crooked because of accident. So again, we can straighten that. That is all rhinoplasty. Again, for the facelift, in case of aging face, we can do facelift. We can also do a lot of non-surgical procedures that are available nowadays. Like, you have Botox, you have fillers, you have threads, you have radio frequency tightening. So these things also all fall in the ambit of plastic surgery. Then you come down to the neck, you have, neck lift, you have a double chin correction. Coming down, you have, in males, you have the man boobs.
Yeah.
In females, you have all kinds of breast surgery. So you can have breast augmentation, you can have breast reduction, you have breast lift, you have axillary breasts. Some ladies have tissues in the armpits, which prevent them from wearing, sleeveless garments and all that. So that is one thing. Then you have the abdomen. So you have a liposuction of those areas, like maybe love handles, or just the abdominal area. You have tummy tuck. You have the thighs, again, liposuction, and legs. So you have, then there you have various implants in various parts of the body. So you can have calf implants, you can have buttock implants, you can have pectoral implants for men. So it kind of covers a lot of things. In addition, a new line that comes is, post weight loss or post bariatric surgery. we see a lot of patients with hanging tissues all over the body.
Yeah.
So there we can do a lot of tightening everywhere, like brachioplasty for the arms. You have upper body contouring, you have lower
Yeah.
body contouring.
Yeah.
So it's like multiple.
Got it.
The indications are multiple.
Yeah, that's very interesting, ma'am, because now that you actually literally listed everything from head to toe,
Yes.
and what we can do is we can deep down into one of that going forward in this conversation. But before that, let's talk about you as a personal life, right? So, how does a day in your life look like as a plastic
Okay.
surgeon?
Well, I guess I wish I had more than 24 hours to complete my day, but I am a homemaker in addition to being a plastic surgeon. So it's like a normal day in any woman's life where I start with, making a little bit of breakfast for the family and then enter hospital. Usually in the daytime, we have the cases in the operation theater in the morning. Because it's always better to operate in the morning so that the patient has a time to recuperate till evening. And usually this goes on till about 3 or 4. And evenings is reserved for probably an hour of yoga. I usually have that is my me time. In the evenings after that is where I see the OPD patients, where the patients who have come in for appointments, they could be new patients or they are operated patients who are coming in for dressings or suture removals or multiple other follow-ups. And yeah, I guess again hospital ends say by around 9 p.m. Evenings would be probably getting ready for the next day's surgery, because for us every case, as I told you, is
Yeah,
different.
it's different.
So if there is something that I need to look up, then that is study time. And yeah, that's how it goes.
Yeah. So, ma'am, what is the one best thing about your profession and what is one challenging thing about your profession, if you have to answer that in one sentence? I know it requires more than just one sentence, but yeah, so let's say a quick one sentence of like the best thing and the most challenging thing about your profession right now.
The best thing is it's constantly changing and evolving, and so that doesn't make it boring. And the challenging thing is that the to be able to live up to the patient's expectations. I think that is very challenging because whatever we do is visible. And if that is not really keeping up with the patient's expectations, it becomes a challenging thing.
So, ma'am, out of all the surgeries you've performed in your professional career, so if we have to segment them into men and women, so let's start with women. What are the most repeated and the most cases that you see in women in terms of
Okay.
surgery? So, I think 80% would be something, one case that's repeated the most, and then maybe rest would be the 20% that occupies the rest of it. So, in women, why do women come the most to the plastic surgeon?
I would say, I think number one would be anti-aging.
Okay.
So, but then they do not want to go in for surgeries. They don't want to go under the knife. They predominantly come for non-surgical options. So, probably Botox, fillers, threads. So, these are the most common reasons why they come. Whitening, that is another thing that they come for. Regarding surgeries, I would say probably liposuction, tops it, followed by the others, like probably mommy makeover and rhinoplasty and all. So, but liposuction is what they usually come for.
So just for the viewers, liposuction, like what was that surgery means exactly?
So, liposuction is basically, we target areas where there is a lot of fat deposits,
Okay.
and we try to contour it.
Okay.
So, it's not a weight loss surgery, but like suppose you have love handles, or some ladies have tendency to deposit fat around their hips and thighs. So those can be contoured to make it more proportionate to the rest of the body. Some girls have a tendency to put on fat in the upper part of the body, like maybe the back and the arms. So those can be targeted specifically. We take very, very small cannulas, thin cannulas, which are say about 3 millimeters in size, and we suck out the fat. And so that gives it a nice contour. Within about a month's time, the whole area shrinks and the whole body gets a more proportionate definition. Yeah.
Got it. Ma'am, just to top it off, right, and I think I'll be adding to the same point going forward. When you said liposuction is something that's not a weight loss surgery,
Yes.
right, and you target few areas of the body, particularly for women. So, do you think, as a surgeon, and I know this would actually get out of, the context of what we're talking right now. So, do you think if would you actually recommend someone to do a surgery, to get into proper shape of that particular body type, or maybe do you think workout is also sometimes that you recommended people? So did you ever turn down any woman saying, "Hey, you know what, you don't have to go through surgery for this, maybe change the diet or maybe change your lifestyle and then
Yes,
do it"?
that's a very pertinent question. It really makes a difference when the person is having an active lifestyle and still she's not able to shed off that particular fat, which is very stubborn.
Okay.
So we always take into consideration the BMI. If the BMI is normal, only then we take up the patient for surgery. But if the patient is obese, then we usually advise her to go in for lifestyle and dietary modifications. And if not, then she will need to go in for another weight loss procedure. And
Okay.
not really, liposuction is not the answer for weight loss.
Everything.
So that we need to counsel because you cannot have unrealistic expectations from a surgery.
Yeah, when we talk about unrealistic expectations, I think you've heard the name of Kardashians in the market,
Yes,
right?
yes,
And I
yes.
think every plastic surgeon is very, very familiar with that, right? And when we look at that as a body type right now, which we know it's not really natural,
Natural.
and women out there and young girls out there are getting inspired by them, and then going to their plastic surgeons and just like showing it up. Okay, this is what I need, right? Do you think that's a really healthy practice, or do you think just meeting the patient's expectations would be something that doctor would consider at that time?
So actually, that's a very pertinent question. These things, we need to really discuss with the patient over multiple sessions. So usually, I call the patient for at least 4 to 5 times of counseling before we go under the knife with them. And there would be probably if a girl who wants to just she's apologetic about her body habitus and she wants to do it just to show off. I don't think she's the right candidate. Whereas if there is a girl who has, who's suffering from what we call gigantomastia, it's like very heavy breasts. Now that is going to prevent her from doing even her day-to-day activity. Her, she's not going to be feeling confident about facing society. That is actually an need for surgery. It's not just cosmetic surgery. It is a medical indication for surgery. So these are two different categories which I would like to clarify with the patient, and only a person who is absolutely necessary, only then we take up the patient for surgery.
Got it. And also coming to the celebrities, ma'am, I guess now that you actually mentioned the two categories, one is a necessity and one is a want of a patient, just, maybe for the glamour perspective, or maybe just she wants to just maybe look a certain way and not having a real need for the surgery per se, right? And so there are few celebrities that are going through, let's say, lip fillers or breast augmentation per se, or maybe having an hourglass figure is something that's inspired by celebrities themselves. So, what do you think would be challenges that comes from that, not from the perspective of not as a want, but just trying to do it out to have an outer look and outer beautification per se. So, yeah.
See, Hamza, nowadays what is happening is a lot of our meetings and the presentations require that the person looks good and presents himself or herself well.
Yeah.
So to a certain extent, I think these are quite warranted. Suppose a person has a crooked nose and he or she is not comfortable with the way they look.
Yeah.
So then in that case, a rhinoplasty is warranted.
Is warranted.
But of course, the patient needs to be of a certain age. He should not be doing it under pressure of somebody, like probably the parents or peers. If the person himself or herself wants, I feel it is absolutely normal. I mean,
Normal.
so suppose a girl is not happy with the way her body is. So a few nips and tucks here and there, say a breast augmentation or say a buttock implant, I don't think it really is unindicated.
Yeah.
Because if some kind of surgery makes you feel more confident, why
Then why
not?
not? Yeah.
Yes, why not?
And it's very interesting, ma'am, because before our interview, I was just reading about this and I happened to come across a CNBC in like a video
Right.
about the rise of the plastic surgery for over like, let's say, a decade. And it's very interesting when you mention people, they actually interact on a day-to-day basis in the meetings. So when the pandemic happened and the 2020 everything was shut down,
Yes.
and I think plastic surgery is the last thing people thought about at that time, right? And it's very interesting where I've actually seen that, and it says a lot of plastic surgeons were kind of concerned if the business is just going to be the same after the pandemic. But to the surprise of them, I think it just doubled down because people just came into the camera and everything got virtual and they were looking at themselves more often than the real world
Yes.
interactions.
Also, another thing
Yeah.
is, probably pandemic gave it, it gave it a different perspective. People
Yeah.
said, okay, this is just one life.
Yeah.
So let me just live it the way I
Exactly.
want to. So
Exactly.
yeah, that also changed a lot of perspectives.
Yes. And also, ma'am, just coming to the women and the cases that you have dealt with, right? And is there any particular age, let's say, if a 16-year-old or 18-year-old girl, she just, goes out there and says, I want to, butt implants or just like maybe boob job and getting done or maybe a lip fillers, is that do you have any particular age to any particular surgery?
Not really. No, not really. It's just that, as I said, I need to have a good rapport with the person. I need to talk to the person at least 4 or 5 times, really try to gauge why is it that she's going in for this procedure. And if I feel that, yes, she needs it and she will benefit from it, then I go ahead and do it. But it has to be at least post 18. Before 18 years of age, it is, of course, the parental influence, and we need to have a parental approval.
Got it.
So that actually works for boys who are born with, not born with, but they develop gynecomastia or man boobs. So they have a lot of these inferiority feelings, and they do come in with their parents for surgery. So these are cases where we need to go in for surgery, even if they have not completed 18 years of age. But as far as the age for surgeries goes, it's more or less after 18. It is as per demand. So
so it's nothing like for this particular surgery you have more side effects if you do that on
not
an
really.
early
We
age?
have, it's like now anesthesia has become very, very safe, and so also the surgeries. Of course, if there is like now, for example, if you have a mommy makeover, now mommy makeover will it includes multiple things, like you can have a breast surgery, you can have a brachioplasty along with it, you can have a tummy tuck, you can have a vaginoplasty, you can have liposuction. So in this becomes a very, very major surgery. So in those cases we may try to kind of section it. So we say at one time we'll probably do the breast and the tummy, and then later on maybe we can address the arms and the legs. So we try not to combine too many procedures in one person, so that it is safe for the person. Why nowadays we are doing like facelift, even at probably 65, 70, 75 years of age, we are getting ladies coming and asking for that. So things are really changing. Yes. And I am seeing it in the last decade, but yes, as you pointed out, more so after COVID.
Got it. And it's very interesting to talk about the mommy makeover, because I think this term is not something that I've heard like a decade ago, let's say 15 years or 10 years ago, right?
Yes.
And two questions. So why do you think more women are, inclined towards this?
Okay.
Is it something on the outer perspective or something that's really needed from the inside, let's say, to the human body, or like, the body that went through a lot of pain through the delivery? So that, and also, where do you think the psychology of a patient to have a mommy makeover comes from? Mostly what I've been dealing with.
In answering your first question, mommy makeover, we don't do it immediately after delivery.
Okay.
We always do it after the person has completed her family, so that she doesn't need to go again through it. So, and after she has recovered from the pain and the recovery process of her giving birth and lactation, breastfeeding and all that. So it is done after a good probably a year or two. Only then we take up the patient for a mommy makeover. Now, secondly, where the indication has come from is, as I answered earlier. So, ladies are no longer restricted to the home. They do go out and work. They may be it may be a gym instructor, it may be a Zumba dancer, it could be an office professional who wants to look good in her body. So that is one major thing that is driving women towards the surgery, and also financial independence. Because earlier, ladies, if they wanted to change something, they would need to ask their husbands for the money. Now they are all financially independent, and they come to us for the surgery themselves.
Got it.
Another medical indication that I would probably put at the top also is that following delivery, there is a lot of change that happens in the lady's body, and that also changes the curvature of the spine. Like suppose she gets sagging breasts, the spine curvature changes, the posture changes. She has a lax abdomen, she has lax muscles. The whole posture and the curvature of the spine changes, which may give rise to a lot of low backache, a lot of knee ache. And when we do these surgeries, it definitely corrects this posture, makes her more confident, and also I would say it helps in giving her a more healthier life. That also helps her to be motivated to do her exercise routine, her lifestyle routine, and give more time and more quality time to her family. If she's feeling depressed about the way she looks, her time and her attention to the family is going to be of that quality. But if she's confident in her skin and her body, she's going to give back that to her family.
So after the mommy makeover, is it really not recommended for that woman to get pregnant again?
Preferably not.
Okay.
But there is no contraindication. But then, see, you're going through a surgery where you're tightening your abdominal muscles, and then you will be going in for a pregnancy again. You may need to do it again, and that's not really.
So will that actually, let's say, once you've did your tummy tuck, and then once you're pregnant again, so will there be any complications per se?
No. Usually it is not. It's just that the muscles become lax again, and the skin would again become lax. She may need a small touch up after the delivery is done. Yes.
Got it. And also, I think there's also a term called vaginal tightening.
Yes.
That also comes in.
That also comes in mommy makeover.
Yeah.
So a lot of ladies do feel that their post delivery the vagina has become loose, and they do come. It's like a tightening of the we have as we tighten the abdominal muscles. We are tightening the vaginal muscles.
Okay. So do you actually have any challenges that you actually face from that, from also the doctor's perspective and also the patient's perspective? Because
while doing a mommy makeover, so as I said, if there are multiple surgeries to be added, then we usually try to keep it safe for the patient. So we don't try to combine multiple areas of the body she may want to correct. We try to keep it separate and safe for the patient.
Got it. And to this particular mommy makeover surgery, ma'am, is it really, are people bound with the financial stuff? Like, is it something really expensive per se?
So that's what, it's like, it depends on how many areas we need to treat. But once we talk to the patient, we get a general idea of what they would be able to afford. And we can tailor make some packages for them. A lot of it does get covered through insurance, though, medical insurance. So if you have really heavy breasts following delivery, which is causing postural problems, that can be taken care of by insurance. A very lax abdominal wall with very loose muscles, which may predispose the lady to a hernia later. That also can be covered under insurance. A large part of this does get covered with medical insurance. So it's not really strictly cosmetic surgery in that term, and that does take off a lot of the financial burden that the lady faces.
Got it. And also, when it comes to aging, right? I think most of the people, that women that actually come to you is like mostly for the aging is why they come, right?
Yes, yes.
And so, what are the surgical and non-surgical procedures that you recommend? And given to that, any particular food choices that you could just mention over here, ma'am? Because I think the food choices have changed drastically with
Yes.
with the rise of, let's say, Swiggy or Zomato that's coming in, and also everyone is working
Yes.
in home, right? And I think we're more inclined to just like have a quick food coming at your
Right.
doorstep than just like going through the process of cooking and then just like serving it off, right? And how do you think the choices of food has also changed and affected aging over the years right now? And
Okay.
what are the non-surgical procedures? Let's start with that first. Yeah.
Okay, the first question is non-surgical procedures. So, as I already mentioned earlier, we have Botox. So, when there are dynamic lines, we can put Botox and actually paralyze those muscles. So, those dynamic lines get faded. And of course, we need to repeat this procedure every 9 months to a year or so. Then you have these static lines where we can put fillers, and there are multiple type of fillers available in the market. So those can be used like for tear troughs, for marionette lines, or any other, like if there are any static lines that are there. You can also use fillers for, as you said, plumping up the lips.
Lips. Yeah.
So those are that is one thing. Second, the third thing is the threads. So you have the skin of the face kind of drooping down because of gravity. So we can use threads to lift up those tissues. This usually lasts for about 1.5 to 2 years, and they may need to repeat. But the best part and the beauty of it is that all these are office procedures. They can just come in the morning, and by lunchtime they can come and they're done.
Okay.
So it doesn't have too much of downtime.
Yeah.
You have other modalities like lasers, you have chemical peels, you have radio frequency. All these are modalities to tighten the skin. So there are multiple options which can be tailor made, again depending on what is the patient's requirement. What's the second question?
The food choices?
Yeah. So food choices, I would say, is I would strongly recommend avoiding packaged foods.
Okay.
Because that is what contains a lot of preservatives and a lot of sugar as well. So I would say avoid packaged foods, ready to eat foods. Always better to have home cooked meals. But in case you do want to Swiggy, Zomato, then go for healthier options like probably salads or soups.
Yeah, yeah.
And avoid carbonated drinks which have loads of sugar, because sugar again causes a lot of inflammation in the body, in various cells of the body, and that could contribute to early aging.
Got it. So let's say what are your top 5 foods that you would recommend that can fight aging?
I would not probably say it's a cause and effect relationship that you take this food and you won't age, but these would be helpful for your skin. So first would be water. Definitely need to have a good quantity of water throughout the day. Secondly, anything that is freshly made. So like any food that is home cooked, freshly made would be the second thing. Thirdly, raw vegetables, raw fruits. So these would be, again, they would kind of have antioxidants. You can have like a lot of probiotics like buttermilk. Maybe that would be a good probiotic. You can keep having it as a hydrating agent throughout the day. And probably if you have a sweet tooth, you could probably satisfy your sweet cravings with natural products like maybe dates or jaggery or something like that.
Got it. And ma'am, it's very interesting to look at how right now in the market a lot of Korean products are coming in, right?
Okay.
I think that's more like, because that is inspired how Korean skin is more anti-aging than, let's talk about India right now that we are living in here. And they say that when you see a 30 or 40-year-old of Indian woman and then a 40-year-old of Korean woman, there's a lot of difference the way they look, and also the skin, and the aging effect is like drastic and very exponential to that level. So is that really have to do with the food they eat, or is it just the climatic condition that comes in?
I would say genes.
Okay.
Secondly, climatic conditions, and yes, the food. But I think genetic makeup makes a lot of difference.
Okay.
And also the skin color. Like if you see the European skin is more prone to aging because they are fair. And you see that even at 30, they develop lines like crow's feet and, whatever dynamic and static lines of aging on the face. We as Indians are blessed in that sense because we have a little darker skin and we show signs of aging a little later.
Okay.
Right. But Korean, this thing, I probably think it could be genetic.
Genetics.
Yeah.
Got it. And just coming to, the men's side of, the surgeries that you have done, I think what would be the 80% that goes with the men's surgeries?
I guess I would put it as for gynecomastia, man boobs, and liposuction.
Liposuction.
And probably next in line is rhinoplasty. A lot of men coming in for rhinoplasty.
Got it. Is there any noticeable difference that you have seen in the surgeries people take in the tier 1 cities and tier 2 cities? Because people, particularly someone who's outside of the medical fraternity thinks plastic surgery is something that you need to effort and it's a little expensive. So maybe people with good money, which is attributed mostly in the tier 1 cities, are prone to take that up. But how do you think tier 2 cities are also changing? Is it, and how?
Yes,
how is
it
that?
is changing definitely. The gap is narrowing, and we are getting more queries and inquiries for surgeries in tier 2 cities. Probably earlier, what used to happen is people from tier 2 cities, the well heeled, would go to probably tier 1 cities and get it done. So, probably that also could be, yeah. But I think now that gap is narrowing, and I don't think that really differentiation is present. To a certain extent, yes. Probably in tier 1 cities, you get more people going in for anti-aging and non-surgical procedures. But it is also picking up in tier 2 cities.
Given how different Indian genes are from, let's say, you go to Kashmir and then you go to Tamil Nadu, it's a drastic difference in the skin type, right? And then you go to West and East, Northeast, and then you go to Gujarat and all. So, what, according to the region, the plastic surgeries differ? Does they differ? Let's just talk about North and South India, and from the skin perspective or from the type of genes they come from. And so what surgeries North Indians go through mostly because of their genes particularly, and what are the kind of surgeries South Indian are more inclined towards?
So the skin type, yes, definitely differs. I think that is more relevant for us because that makes us select the type of incisions, like where we're going to take the cuts so that it heals without any scarring. So the scars are more visible in South Indian skin. So we try to take the cuts where in the skin creases so that they are hidden in the skin creases. Regarding the type of surgeries, I would say I think all Indians battle with weight in different parts of the body. So I think again liposuction would be a common procedure. But a lot of South Indians I do find going in for skin whitening and probably more of changing the skin characteristics more than North Indians.
And what are the surgeries more North Indians are inclined towards?
I would say probably rhinoplasty or facial beautification. I think that would be more common there.
Got it. Got it. And also, I think on a very higher level of these surgeries, I think the transgender surgeries, like changing the surgeries where the gender augmentation comes in. So how did that actually pan into your domain particularly?
Okay.
And what are the most challenges that you actually face as a surgeon, and also challenges that a person faces from there?
So transgender is really a subject that is close to my heart. It is because initially when I started doing these surgeries, I did not really realize the kind of trauma that these patients go through. They really feel trapped inside another person's body. And once you do the surgery, it is really transformational for them. So the challenges are to be able to convince the person's family, because if they are brought by their parents, it is really a tough time to convince the parents that yes, this person needs this surgery. Most of the times they don't come with family. They usually belong to a cult, and they come with some other person who has undergone that surgery. And so, the financial backup is a challenge for them. Secondly, we need a lot of legal formalities before we do, because this is an irreversible surgery. So we need to have two opinions of two psychiatrists. Many times, psychiatrists are not willing to give us that clearance because they don't want to get into this, legal issues. We need an affidavit which is signed by the person, stating that, yes, I want to get this surgery done. So that cannot be done unless the person reaches 18 years of age. Before that, the parents have to be ready to bear the cost and, sign that affidavit and all that. So it is a really uphill task for them. I would really wish if the state could take in, certain initiatives where we could help these people get all their surgeries done. Um just converting the gender is one issue, but then there is a lot of challenges that they face regarding their voice, because then they need to take hormonal treatment for changing the voice. The facial transformation, that is another major surgery that they need to undertake. So, they are, the very fact that they are willing to go under the knife so many times just to align themselves with what they consider they are is really mind-boggling.
Yeah,
So
yes.
I really feel that we need to do more as a state, as a country, for them to be able to be included into normal society. We should be more inclusive of them.
Got it. And also, ma'am, just what would be the range of this when you say it obviously costs a lot in the general? So, what is like, let's say, a rough range that goes?
No, it's difficult, Hafsa, because see, this in we need to incorporate a lot of surgery. So it could be just a top surgery, it could be top and bottom surgery,
Okay.
and then post that there is hormonal follow up. There is, as I told you, if they want something to be changing the shape of their face, because a male face is totally different from a
Different from a
female face.
female,
So if they want to do that as well, so that really builds up the cost. It all depends on what they want, number one, and how much of social backup they have. So in that case, we can always work around that and try and help them to a certain extent.
Got it.
I remember one case where there was this lady who was, it was a male to female. After I did the male to female transformation, she was also, she took the hormonal treatment, and she also underwent a facial feminization, and it was really a different experience seeing her transform from a male to a female. So much so that she then started wanting a uterine transplant to be able to bear kids.
Okay.
So that is, of course, something that I then put her across to the gynecologist. But that is the kind of satisfaction that it gives to the professionally to the doctor, and the patient is like always indebted to you for
Got it.
life.
Yes. And that was actually my follow-up question. And how does the reproductive system, change? Let's say from male to female, and he does, goes through this surgery, and if he opts for the reproductive system,
No, it doesn't.
it doesn't
work.
happen like that.
No.
So it's just the outer
we have to take it in writing that they will not really be able to bear children in the future.
bear children in the future. And the same applies to women.
Yes, to a woman as well.
Got it. Yes. And also, ma'am, let's talk about how, how do you see the plastic surgery transforming for next decade? And do you really think this industry is something that is just, obviously, it's just more than a glamorous industry. You're transforming life one at a time, be it, treating the patients who meet with an accident, or maybe the gender identity crisis they have, or maybe just making someone feel better than what they are, a mommy makeover and liposuction. I think a lot of these surgeries are more than just a glamorous field, right? And I think that really gives a happiness from the inside out to a person.
Yes.
To be happy with himself. And I think that's where the work that he's doing and the person is being with his family obviously changes and improves. So how do you think these cases and the whole plastic surgery in general is going to go forward in the future, and how do you see the future that's coming ahead
So
for us?
I think it is just going to increase. I mean, already we have data which says that just cosmetic surgery alone, we do almost 12 to 15 lakh cases a year. In the year 2023, that many cosmetic surgeries were done, and I see it increasing probably every year 3 or 4 times because of the advent of social media, and also people are more financially independent,
Independent.
and they are looking at marketing themselves and branding themselves. So that is definitely going to go ahead in life, ahead in the country. Regarding what was the second question?
Yeah, so let's say these, the wanting to be a better
Yeah,
version
so
would be.
yeah, so that definitely I would say improve their confidence levels. And I always see patients, which have operated a few years back, and then they are happy with what I have delivered. They keep coming back for surgeries on the other parts of the body. So there is, like, if a patient is there with you, he's usually your patient for life. And also, what I would think is that with a lot of industry people coming into this, the safety of the machinery and the instrumentation that we are using is also increasing leaps and bounds. The quality of the breast implants that we were doing 20 years back to what we are using now is definitely many notches higher. So that way, the safety, the quality that we deliver is all just going to go on increasing.
Got it. And just, looking into the little extreme side of, now that we talked about how good it can be, let's also talk about how bad this can get. So, do you really think people are just developing an unhealthy obsession for just
Yes, so
physical?
every good thing always also has a bad thing about it. So that unhealthy obsession needs to be balanced somewhere. Another thing that I'm seeing, actually, we all are seeing, is a lot of non-qualified doctors, or even if they are not doctors, they are calling themselves plastic surgeons, and professing that they're doing these kind of surgeries, and that is where a lot of harm is being created. When the quality is not taken care of, we are having a lot of complications, so morbidity and mortality also is increasing. So that is something where we need to have checks and balances, both from the patient perspective. So the patient should have a very educated opinion, and he should do his research, and also the powers that be. So they should make it compulsory for a person or a doctor to register with the certified board before he or she can be allowed to do these surgeries.
Got it. And so, what advice would you give to the budding, plastic surgeons who aspire to be maybe remotely in the place you are today, or something? You've inspired them. So, yeah, I think to any plastic surgeon out there. So, what would the advice
I
for
would
you?
probably say that it's a canvas, and if you have any little bit of artistic talent in you, and you would want to get that into your surgical practice, then definitely choose plastic surgery as your specialty, and you would always be there will always be something different to look forward to every day.
Got it. One last question, ma'am. So, what would you advise your younger self, let's say, just before you started your career, and with all the mistakes you have done, or maybe like the learnings that you had, and the challenges or opportunities that you embarked on? So, what would you advise your younger self after everything that you've been through?
I say that I would probably tell my younger self to take it a little easy, because probably I was always in a hurry to get there, and now that I look back, I feel that okay, probably 2 or 3 years does not really make a difference in a lifespan of 60 years.
Yeah.
So I would probably tell my younger self to take it easy, go easy on myself, laugh more, enjoy more, and not be so dedicated to your profession, which I was earlier. Because I was, I think, very ambitious, and I wanted to reach where I have done very early on in life. So I think that is what I would probably,
Yeah, I
yes.
think, well, that sums up, and I think I had amazing time,
Thank
and
you.
you cleared a lot of my stereotypes and, misconceptions of what I thought the plastic surgery or cosmetic surgery was, and I think that's going to be applied to the same for the people who are watching us. And thank you so much for, taking your time out, ma'am, and I'm really, really happy
Thank you.
that I got the opportunity to just sit across you and then like listen from the best. And yeah, I'm looking forward for more of these conversations ahead, and I hope like a lot of viewers also learn, and also I think next time they look into a plastic surgery, not as with the fear, but more like an investment on themselves.
Yes.
And obviously, with the right doctor comes the right surgery and
Solution.
also solutions, right? I think that's something that we've learned, and I think that's a great takeaway from my conversation with you today. So thank you so much once again, and
Thank you
here,
very much, Hafsa, for having me here.